He pulled out a pen on a cloth, it was a paper tablecloth, and described to me how excellent this was. Now, anytime you're going to use chlorhexidine, and of course we're using sodium hypochlorite, for whatever reason there's a chemical reaction between the two. You have to clear one before the other. So I use an anesthetic cartwheel. One full cartwheel, rinse out the hypochlorite, and then now I'm going to irrigate with my chlorhexidine 2%. And then what am I going to do? Irrisafe. Irrigation is it right now. We have lots of different ways to instrument. I think this is the best way to this point, based on my own personal results and feel. And my partner, who is in his late 50s, who never switched anything, and he loves these instruments also. And we're having just greater success with them, being able to open canals larger, being able to maintain canal anatomy. And again, this is our chlorhexidine. We'll dry it. And I'm going to move on. So this is now going to be second treatment visit. We're almost done. Irrigation and obturation. Okay? Access has already been opened. We're starting to irrigate. Came in. Calcium hydroxide is pure white. Beautiful. So happy. Happy for this patient. Gutta-percha points are fitted. The gutta-percha will be the exact same size, okay, as the last file that we used. Fit them in. We got a master cone film. I typically don't take a working length film. I think it's important to take one. If you're not as experienced with the apex locator, we can see we have a nice fit here of all the cones. You're always going to see, especially in silver point cases, sometimes residual debris. And now we're going to obturate. So first, a little more irrigation. We'll go sodium hypochlorite along with the smear clear. Smear clear is 70% EDTA. It's a chelator. It's going to help, again, remove the smear layer. Again, my irrisafe tip. You see the trend here. Always trying to irrigate better. Always trying to push that irrigant where it needs to be.
You have 5 minutes.
Yes, about. It's going to be perfect. Okay, so again, we're going to use the cartwheel of anesthetic. And again, this is just to build up, to prevent the buildup of the chlorhexidine and the sodium hypochlorite precipitate that forms. I'll just kind of skip ahead just a little bit here. Irrigate again. Chlorhexidine. Dry it nicely. And now let me show you the warm vertical technique. I'm using gutta-percha and the classic Roth sealer. And we're going to use the Elements Obturation Unit, which is a System B, and then a backfill device. The cone is placed in the canal with the sealer. The System B is used to downpack the cone. And we'll follow it up with a hand plugger to just get a nice vertical compaction. So what I'm doing here is gutta-percha is my vehicle to deliver the sealer into all those little irregularities that we've been talking about. So by using the warm pressure, you saw the System B tip come in, warm pressure, and now I've got a little apical plug there, and by compressing that, now I squidgy all that sealer into all the tubules. At least theoretically, that's what we're trying to do. I'm going to use a plugger. Here's another cone. Again, the sealer in place. System B tip. Warm vertical pressure. Thermoplasticizing, softening that gutta-percha so that we can compress it. Because we've prepared it well and have a cone that fits so well, we can put a little pressure on there. And instead of seeing the gutta-percha go through, we see the sealer move laterally. Compress it with a little instrument again. One last time. See quite a bit of sealer there. System B. Heat. Down. Guideline 5 millimeters from your working length. Use your own best judgment on that. Compress it. And then we'll backfill as the last step. So you can see nice gutta-percha there. Such a nice feeling. You start out with this dirty, contaminated silver point and debris. And then when you're done, you see this orange shine up along the walls of this really clean, nice canal. And you know that, again, you've done your part to set the stage for healing. You can't heal for the patient, but you can set the stage. We're going to backfill now with a thermoplasticized gutta percha, which helps to just densely fill. This is obturation made easy. Adding one standard gutta percha cone, spreader, gutta percha, sealer, spreader. Instead of adding a million cones to try to make one unit, you add one cone and then you backfill. And you'll see. Little sealer on the end, I'm going to place it in. I'm going to have the heat of this tip meld with the plug that's there and backfill it right out. And you see that nice mass of gutta percha there. And we'll go through on the last two. This is how I do endodontics. This is just an example of a retreatment. Silver points, a great way to demonstrate kind of all of the tricks that we've talked about today. Our enemy is bacteria. They're shifty, they're persistent, and they really can evade almost everything we throw at them. But science and evidence-based dentistry allows us to come up with new methodology, new equipment, new rinses, new everything to try to fight them, and we'll continue to do that. And my feeling is you have a lot of options out there dentistry-wise. If a root canal is failing and you offer the patient the option of an implant without giving them this possible service, I think it's a real disservice, because implants are a wonderful, wonderful treatment when appropriate. But to save the patient's natural tooth is really what, as dentists, and especially as endodontists, that we're trained to do. And I will continue to do that, and I will continue to try to give the best possible treatment. And if anything I've shared with you today is helpful in your chair, then I will have accomplished what my mission was here. It's been such a pleasure to be here with you in Dubai. Thank you to the organizers, and I hope you have a great rest of your meeting.